I'm going to talk to you today a little bit about the most common signs of illness in kittens that we see at the shelter. So, the big three are weight loss, diarrhea, and upper respiratory infection. Let's start with weight loss. You might hear us also refer to this as failure to gain weight or not eating well. So, what does this look like? In addition to failing to gain weight at regular weigh ins, you might also notice that the kitten seems to be only eating very small amounts. They might only look at the bowl, or the food bowls rarely look touched. Another sign is that you don't actually see them eating. When you spend time in the foster room, you should notice them going over to the food bowl, especially after they've had a play session or when new food is offered. You might notice that there isn't a lot of poop in the litter box. Kittens should be pooping around twice a day. Kittens that are eating well will be pooping well too. Kittens that aren't eating well can become nauseous due to a buildup of acid in their stomachs. You might observe a kitten vomiting bile, foam, or clear liquid if they're not eating well. You might also notice that the kitten seems a little off. Maybe they're more sleepy or they're not as playful as they usually are. So, why do kittens lose weight? There can be many factors that contribute to kittens losing weight or not eating well. A lot of times, there's multiple reasons. A huge factor is stress. Kittens coming into the shelter are going through some really significant life changes that can be very hard on them. Oftentimes, they are losing the only home they've ever known, or sometimes they're being separated from their mom or their siblings for the first time. They've come to a strange place with all new sounds and smells, and it can just be a lot for them to handle. Cats, in particular, are really susceptible to stress, and kittens are no different. Another thing to remember is that they're just babies. Sometimes they need help remembering to eat or finding the food bowl. They're dealing with a lot of changes and can become overwhelmed easily. Even healthy kittens that are having a great time playing with toys and people in foster care can forget to eat. There can also be underlying issues going on that could be contributing to their lack of appetite. They could be coming down with a cold or could be exposed to a virus and they're just not showing symptoms yet. If your foster kitten isn't gaining consistently, we need to intervene. The second most common thing that we see in foster kittens is the dreaded diarrhea. Our treatment plans often depend on the extent of the diarrhea, so it's important to be able to describe the stool and understand if it's improving or worsening. To do that, we're going to have to look at some pictures together. Diarrhea is liquid stool without form or texture. It can be described as watery, soupy, or pudding-like. It might look like a bunch of puddles in the litter box, or you might have trouble telling the difference between pee and poop clumps. Kittens with diarrhea that goes on for several days will often get irritated bums, become dehydrated, and not want to eat. In these pictures, you can see that the second and third picture is better than the first, so I would say that that's signs of improvement. These next series of photos are what we would describe as loose, unformed stool. This is still not normal, but it's an improvement over liquid diarrhea. Most often, people refer to this type of stool as a cow patty. We would describe the poop in this next picture as loose formed. It's moist, but it has a defined shape and looks like soft serve. It's normal for kittens to have stool that looks like this occasionally, especially if they're good canned food eaters. Other things that you might see in kittens that are having loose stool or diarrhea. They could be not eating well. They might be having accidents outside the litter box. You might see diarrhea caked in their fur, around their butts or their hind end. They might be more quiet than usual. Kittens that have diarrhea get dehydrated really quickly, and that can just make them feel pretty lousy. So why do kittens get diarrhea? There's lots of reasons. One being stress, going through all the changes that I mentioned previously. A sudden change in their diet can cause diarrhea. Now, this one is tricky because most importantly, we want kittens to eat, and therefore we recommend offering a variety of food to encourage them to eat. But as long as your kitten is gaining weight and eating well, you can keep their diet consistent. Kittens can get diarrhea from parasites. All kittens are given dewormer as soon as they come into the shelter. However, depending on the life cycle of the parasite or how infected they are, they might need several rounds of treatment, so diarrhea could still develop. And oftentimes, we don't know why. It can be really frustrating to watch your foster kitten have diarrhea and not be able to get to the bottom of it, or for it to take a while to get better. But that's just the reality of our kittens that are oftentimes coming from outside or less than ideal circumstances. If your kitten is having diarrhea for more than 24 hours, we need to intervene. The last condition we're going to discuss is upper respiratory infection, which we often call URI or kitty cold. Signs of URI are most commonly seen in the eyes and the nose. You might observe discharge from the eyes that is watery or thick and yellow in color. The eye might be red or swollen, or the kitten is squinting or have a hard time keeping the eye open. If the eyes aren't kept clean, the fur around the eyes can get really crusty. You might see a similar type of discharge from the nose. It can be clear, green, or yellow in color. But usually before you notice a discharge, the kitten will start sneezing more frequently. Significant discharge from the nose can lead to nasal congestion where the kitten sounds stuffy. As discharge dries in the fur, it can look a little cakey. One particular strain of URI that causes severe illness in kittens can lead to painful ulcers developing on their tongue. They look like red spots or blisters. Similar to the other conditions, kittens with URI usually show other signs of illness like not eating well, being quiet or withdrawn, and losing weight. Kittens with URI sometimes don't eat because they're so congested that they can't smell their food. They can also develop fevers, which makes them feel really lousy. They might look depressed or not want to play. If your foster kitten is having any signs of URI, we need to intervene. In the early stages, we might just have you monitor, but you should still let us know. It's important to know about the medical conditions that are most likely to affect your foster kittens. The reality is that most kittens that come to Dakin will need medical care at some point. Even if the intention is to foster healthy kittens that don't require medication, there's a good chance that at some point one of your kittens will develop an issue. The great thing is that we know how to treat these guys. We see hundreds of kittens every year and have developed protocols that work. It can be really rewarding for you to play a part in helping them feel better. Of course, there's always the option to bring your foster kittens back to us if you're feeling overwhelmed by anything that's going on with them. Some kittens could stay in the shelter for a few days for treatment by our technicians, or we could find them a foster home that is more experienced in providing that type of care. We're so happy that you're willing to foster kittens. We never want you to feel guilty bringing them back. We want everyone involved to have a good experience. And we thank you for fostering.